one of the things that also strikes me, I'm thinking about who's going to watch this, right? And we are an eclectic bunch, psychologists. Some of us are maybe CBTers, some of us psychodynamic, some
Yeah,
of us EMDR, or often what's probably the most common, I think it's around 70%, we kind of just grab little things from
yeah,
everywhere.
yeah,
And I think that some people out there might say, well, feedback informed treatment is for this model.
yeah,
That's for CBTs,
yeah,
right?
yeah,
I can see you already
yeah.
shaking your head, right? Because I actually personally I like the other ones as well, like psychodynamic and those
Yeah.
kind of things. And maybe you can just speak to in terms of your work using fit, do you feel constrained at all to any models that you need to learn, or do you feel free to learn whatever you want, whether it's EMDR,
Yeah.
psychodynamic? Yeah, I'd love to hear about
Yes,
that.
absolutely. And I mean, there's an in the article that I've written, I quote
Mm,
Bruce Wampold in one of the interviews that he was giving, and he was going, look, you know, if you have two or three models that you feel make sense to you and that you feel competent in, and you need, that's all you need. It's something to come back to. But really,
mm.
ultimately, as he's saying, with what's how does he call it? Um
The dodo bird effect, or no?
no, yeah, all
No.
the models work exactly the same. I mean,
Mm,
the data has shown that comparing models against models, they're all, about equally effective. So it doesn't
mm,
really matter. It's about, it's like what the TDPA is saying. So first off, it's up to us to provide a structure so that the client feels held in some way, whether it's
mm,
CBT, EMDR, whatever, a an evidence-based practice, not just waving hands or, doing
mm,
something that doesn't really have anything behind it. So, so the structure, so the other things are like, that's the art. It's like hope and expectancy. The second thing, how do you provide a little bit of hope or let them know that they can expect that given what you're saying and, and what's been going on, this isn't something, this is stuff I've seen before. It doesn't feel like
mm,
it's, anything that is going to be unfixable if we can work well together. So you kind of
mm,
weave that into it in some way or another. Then you're kind of really working on the alliance. So the relationship
mm,
factor between you and the client. And then taking into account the client, that's the fourth aspect, the client factors, what
mm,
in their life, in their context, in their whatever you may be impacting positively or negatively that in the work together. And then looking at our factors, what do we need to do to kind of be flexible enough and in the moment enough with this client in this session. So they're
mm.
all the things that to me gives me an immense amount of freedom. It's not
Yeah,
constraining at all. I don't have to do, I mean, I've done so many models, I don't have to do this model or that model or this model. It's like I'm trying this and I'm checking out, is this making sense? Is this something that you want to explore more today? No, okay, what do you want to talk about then? Or what is it, what's worked before? Where did it get stuck? What else might, and, so I'm just going to pull up whatever. I'll do whatever it takes to help them, so it's
yeah,
very freeing. It's not constraining at all.
wonderful.
So it allows creativity, basically. Yeah.
That's absolutely what I hear from you.
Mm.
Creativity for you and flexibility to the attunement to the client.
Yeah. Yeah.
Yeah.